Hello, I'm Alexandria Avila, and this is my presentation on aphasia. This is for CSD 0493 for Professor Susan Newhouse, and today is June 16th, 2024. So let's start out by talking about what is aphasia. So aphasia is a person who may have trouble understanding, speaking, reading, or writing. So this is where a speech-language pathologist can come in, because they are the professionals who work with people with communication problems. So they can be able to diagnose and treat the difficulty of aphasia. It can help treat the understanding, the speaking, as well as the reading and writing. So speech-language pathologists are important when treating aphasia. Who can get aphasia? So most people who have aphasia are middle-aged or older, but anyone can acquire it, including young children. This was stated in the article, What is Aphasia? There's also no medicine to treat aphasia, but there are different activities to do in therapy that can help treat it. Now let's take a look at some signs and symptoms of aphasia. So some signs and symptoms may include difficulty communicating, not being able to express yourself, not able to think of the words that you want to say, following directions, recognizing objects, reading, and writing. There are also much more signs and symptoms, but these are just a few of them that I listed here. So some may ask, what can cause aphasia? So aphasia can be caused by a stroke, brain infections, brain tumors, and any other brain disorders. So any change to the brain can cause aphasia. Here's my client information. So my client Mary is 44 years old and is diagnosed with aphasia. Mary noticed that she was unable to understand others, and her family members tell me that it is hard to understand her as well. She wasn't able to recognize a spoon or fork. She was also unable to express herself. Family members were concerned as to why she wasn't able to look happy when she would feel happy. So moving on to the therapy plan. So first, I would like to do an evaluation, then plan the treatment, set a goal, but I would also want to set the goal while planning the treatment. I think that is good. And then do therapy. So I want to see what activities they do better with, or which treatments they might do better with. We're going to see how that goal is working out, and then see what's the next step after that. So here's the goal. My client will be able to communicate verbally or non-verbally at least 75% using the conversational approach. This will be done in my therapy session with them attending at least 3 days a week. This will be done in a span of 6 months. So SMART goals are important because it would allow us to see if the client is doing any better, if the treatment plan is working. It will also allow you to change your treatment plan if the goal is not being met, or if it's not being reached to the level you would like for it to. So making a SMART goal is important, and it is important to make sure that it is also made for your client. How to carry out a plan smoothly. So on the website Tactus Therapy, it does state to talk to their friends and family, of course with the patient's permission, and use questionnaires or motivational interviewing to gain an idea of what they are interested in, as well as the specific situations in which their aphasia causes them problems. So finding out the behavioral objectives, which is why we would want to talk to their family and friends, it is important because it is to make sure that the plan of the patient is going smoothly. We also want to see that there is progress being made throughout the treatment. So some activities that I would like to do with my patient would be to sing, let's say, the happy birthday song. The happy birthday song will allow them to express themselves. But I would also like for them to choose one of their favorite songs. So ASHA does state that therapy activities will allow you to participate in things that are important to you. So some activities help you improve language skills. So this is also why I would like for them to do a song of their choice, because the song is probably important to them. So it will allow them to participate more in this activity. Another activity I would like to do would be drawing or painting with them, because it gives them the freedom to draw or paint whatever they like, and it will allow them to express themselves in a different way.
So that was just a piece of the happy birthday song that I would like to do. Since it is a slowed down version, I think it will be better for the patient because it will allow them to sing the song in a slower way. It will allow them to express themselves better.
Let's look at assessment measures. So an assessment measure looks at goals, progress, analysis, evaluation. We also want to see the end result. It's to plan this treatment so we can get the correct assessment. So I would think a comprehensive assessment would be great for Mary, because this will assess her communication performance, her expressions, any changes that are being made, as well as her social roles. This will show us how she is making progress throughout the treatment plan or throughout the therapy plan. It will also show if she's expressing herself more, if she's becoming more social, things like that. So here are a couple of tips if you do know someone who has aphasia. So you want to make sure you get their attention when you're speaking to them. You also want to speak in your normal voice unless they ask you to speak louder. Another one is keep the words simple, but don't treat them like a baby, because they will notice. Next is slow down when speaking. Also ask yes and no questions so it can be easier for them to answer. And you also want to give choices instead of doing open-ended questions, because then they may struggle to answer those open-ended questions. Some other tips that I do have is you want to give them time to speak. Make sure you're not rushing them into saying their answer quickly, because if you are, then it might frustrate them. It might not get them to answer your question or to answer you or to even conversate with you, because they feel that they're not able to communicate correctly with you. That was my presentation, and thank you for learning with me. These are the references I used throughout my presentation.